Today we are going to be showing you how to place CPAP on a patient. First, we're going to start all of our scenarios with BSI and safety. Some indications when we would use CPAP is going to be anything when there's fluid or secretions in the lungs. So pulmonary edema is a big one, pneumonia as well as asthma. Some contraindications when we're not going to use CPAP, the biggest one is going to be that systolic less than 90, as well as if the patient isn't even aware to maintain their own airway. Going along with maintaining their own airway, if there's any secretions in the airway, also contraindicated. If there's a big trauma and there's any facial trauma to the patient, CPAP is also contraindicated. So now that we've gone through the indications and contraindications, let's go through the procedure. First, we're going to get a full set of vitals, especially a BP, like stated before, because that's a big contraindication, and making sure our patient is followers to semi-followers. Now that we've gone through our vitals and positioning, let's assemble the equipment. So this is going to be the mask. There's a connector that fits directly into the mask, and then the other side of the tubing is going to go into your oxygen source. All of the masks are going to have a indicator on the tubing that shows you what to titrate for the specific PEEP. So we're going to start off at 5 PEEP, which is going to be for our mask,
15 liters per minute.
Place the mask, just the mask, on the patient's face. So we have the mask on the patient's face. We're coaching them through it, asking them how it feels. If it feels all right, we're going to go ahead and secure it. My partner here is going to help. You got that side? So with these masks, there's about 4 connections. And then the forehead piece also moves, so play around with that if you get a chance. Making sure it's all snug. When the mask is on the patient, we're going to keep coaching them through it, telling them to breathe in deeply, and asking them if it's comfortable. If it's not comfortable, or if the patient decompensates, we're going to remove the mask. So there's 2 clips, they come off pretty quick. We're removing that mask. And then they're decompensating, no longer can maintain their own airway. We can use alternative solutions like a bag valve mask here. So with CPAP, there's also a lot of CPAPs have connectors that come between these 2 that a dual neb can go in along with the CPAP. So that's pretty cool. So when you're transporting a patient in CPAP, you're also going to want to call that receiving medical facility and let them know you have a patient on CPAP so they can be prepared and set up their CPAP machines for you. And as well, a patient on CPAP is most likely going to be in critical condition, so you're going to want to reassess every 5 minutes.